Hi, am I audible?
Yes, yes, Reena, you are.
Okay, so good evening to everyone. I'm Dr. Anna Mehta. I'm the Vice President of the Global Working Group at GSN, and I welcome you all to today's session, Dress to Impress. It's a 101 guide on scrubbing, gowning, gloving, and degloving. Our speaker for today is Dr. Hansel Misquitta, a former house officer in the Department of Minimally Invasive Surgery and Plastics and Reconstructive Surgery in Mumbai. She is a surgical educator for an undergraduate medical students interested in surgery. Please welcome Dr. Hansel. It's a pleasure to have you with us today. Just a little,
Hi, everyone.
hello.
Thank you, Reena. Yeah.
Yeah. Just a little heads up for all the participants. For those of you who haven't filled the pre-event questionnaire, please fill it before the session starts in the next 5 minutes. Also, for the post-event feedback form, please make sure to fill it along with sending pictures and videos of yourself during the tasks of this session on the WhatsApp group to make sure that you are eligible for all the certificates. You can ask any of the questions to Dr. Hansel while the session is in place. So, what you can do is there is a feature on Zoom or even on the Zoom chat where you raise your hand. So, if you have any question or any doubt, please raise your hand so we can stop. We can take a pause then, and you can ask your question and clear your doubts. Also, yeah, it's no exam. It's a very interactive session, so please don't get intimidated by Dr. Hansel. She's really nice. She's very friendly. So yeah, and okay, so I'd like to introduce the GSN team out here. We have the global working group directors Ananya, Divya, and the leads Kabila and Alia and Negansh. So in case you have any problem during the session, please make sure to message either of them, even if it's on the group on the WhatsApp group of Dress to Impress. Along with them, we have Rohan and Tejas from the digital team who made sure that we have a very smooth running session. And we have Mahi from the social media team. So there'll be pictures and videos taken during this event. So make sure to stay till the end so we can have a group picture of all the participants, the speaker, and the team. With all of that information, let's start the session. Over to you, Dr. Hansel.
Hi, everyone. So I'm just going to ask you a standard question before any Zoom meeting starts. Am I audible? You can just type a yes. Oh, lovely. Okay, so we have around 20 people, not bad. So I assume most of you are either medical students or interns. Am I right? And anyone doing their internship or in final year? How many of you? You can just type in the chat box, so that's okay. See, I want to keep it as interactive as possible. I am not intimidating. First and foremost, let me start by saying, do not call me ma'am. Okay, I am not that old, so do not call me ma'am. First of all, it makes me feel old. Secondly, I feel this. I'm totally against this entire hierarchy system that we have in India. Unfortunately, I think that creates a barrier to learning. So I learn a lot from my juniors and my seniors as well, and I hope that you can take away as much as you can from this. So please, first of all, get that notion out of your head that I'm some ma'am or something. No, okay, we're just having a friendly, interactive and educative conversation out here. Okay, so how many of you who has attended any surgery recently or in the past? So since I think I can see third year, final year, done. Okay, so I think probably the interns must have attended during their postings. Final years, I don't know if you guys go to the OTs, but let me tell you something about me when I before I start. I attended my first OT before I entered medical school. So yeah, we have so things are so that's the beauty of India. We can just enter anywhere, and sometimes you can just make some contacts and just go in. So I actually attended my first OT before I entered my first year of MBBS. I was lucky enough. I knew someone at Nair, and since I think people are from all over India, Nair is a very big medical college in Mumbai, and I had a friend there, so he was in his third year and he had an OT that day, so that's how I just attended. Um, Having said that, most of you, I think have come to this session today because you are interested in being a surgeon. So let's make the most of it. And if you've been to the OT in the past, I'm sure all, and I've been there as well. All as medical students and interns, when we were interns and we were medical students, we are notoriously famous for not following OT protocols. I mean, you'll have the scrub nurse or the OT nurse just yelling at you, or you'll have your consultant yelling at you, or you'll have your resident yelling at you for. Reena, before I just start, should I share my screen or should I wait? I
Yeah,
think
sure. You
I'll
can.
share my
You,
screen.
yeah.
I'll share my screen. Yeah. Okay. Can you guys see the screen? Okay, one sec.
Yes, it's visible.
There is. Oh, this is blocking. Oh, okay. Okay. Uh, I don't know how to make this into a full screen, but let me try. Can we do that? Okay, I don't think I can. So let me just block this by. Okay, yeah. Oh, lovely. There we are. So yeah, as I said, we all are notoriously famous for not following OT protocols, but unfortunately, we are expected to intuitively know everything before we enter the OT. So we are supposed to know the steps of scrubbing. We're supposed to know what sterility is. We're supposed to know. Probably they also expect us to know how to operate. So unfortunately, there's no one to teach us. And some of you may be really blessed to have a surgeon or one of your seniors or the OT scrub nurse teach you. So, see, first of all, it is kind of overwhelming in India because of the number of cases that you have in government hospitals. So, it can be difficult, but sometimes you just need to connect with a few people, get hold of one of the OT nurses who's free. Or I learned my first suture from, we have mamas and maushis in India, the ones who shave in the government hospitals. We have the shavers, so those people who shave body parts, especially before the OT, the ward boys. So the senior ones, they actually know really good suturing, and I learned my first suture from them. The second suture, the second time I sutured, I had a brother or a male nurse who taught me, and then I learned it from a surgeon. So you can learn from anybody, but yes, a surgeon has studied for so many years, so he's going to be able to guide you better. So this session now, as I say, virtual learning platforms. Um, I'm not really in for the entire thing because there is an issue with the learning curve, compared to something where there's a downside because when you're physically there, I can actually teach you how to scrub your hands. I can show you how to wear your gloves because that gets a bit better. But this is going to help you for sure entering the OT, not blindly, but having some background as to what OT etiquette is. So this session, though the slides are about scrubbing, gowning, gloving, degloving, but I have encompassed OT etiquette in general because you need to know what you have to do before you go to the theater and during. So it's very important, especially for those who are surgical aspirants here. And thank you, Team GSN. You guys have made an amazing. So these slides have been made by them, and they've kept everything I've said in mind, and they've made amazing slides. So very, very creative and very nice. So I will go through some of the theoretical stuff, just respecting their effort, but I'll try to keep it as interactive as I can. So Yes, since most of you, I think, have not, like, I think got one comment in the chat box that one of you must have attended an OT. So what do you do before you enter, go for your OT? When does the process start? So let's start with some etiquettes first. So how do you start? Can anyone tell me? If you want to unmute yourself and talk, feel free to. I think that should be okay, right, Reena? I think it'll make it more interactive. So I think someone can unmute themselves, raise their hand, and tell me, how does your OT journey start? Does it start at 8 in the morning? How does it start? I mean, it's an open-ended question. There's no right or
Yeah,
wrong
sure.
answer
Let's
here.
let's do that. You all can
Yeah.
unmute yourselves and answer all of these.
See, as I said, what we are going to be doing here today is just going to save you from some embarrassment that you might encounter on your first day of surgery. So, if any of you have already encountered that embarrassment in the past, and if you want to share it, please feel free. Let's learn from each other's experiences. Okay, it's okay if no one wants to. Has there anyone who's raised their hands? I don't think so. So your journey actually starts the night before your OT. So say I have my OT scheduled for Monday morning at 8 a.m. And in most of the countries, it starts at 8 a.m. because here in the UK, it starts at 8 a.m. In India, I've seen it start at 8 a.m. It doesn't start at 6 a.m. in the morning for you. It starts the night prior to that, because what I want you to do before you attend your OT is read about the case. I'm sure you'll come to know a day in advance if it's an elective case, and if the patient is posted for surgery the next day, you might know what the case is, and obviously you'll know the OT number. You can't just get up and walk into the OT. So you need to know what you're attending. So say you're attending an open appendicectomy, or you're attending a lap chole, so you know what your case is. Read about it. Now, when you start reading the anatomy. Because first and foremost, you're not going to be a surgeon if you don't know the anatomy. So you need to know where you take the incision. Watch a few YouTube videos if you can. Not really helpful, but read anatomy. That is important because the surgeon doesn't expect you to know the surgery, because that's what you're come there to learn. So don't act over smart. If you're coming to learn, you have to be very receptive, very open. Learn basic things like anatomy. The surgeon is definitely going to ask you to locate a few things, or while teaching you, he might ask you, okay, what's this? So you need to know, and obviously you're there to learn. So it will give you a better idea and it'll help you learn better. So read up on the anatomy. You don't need to know the surgery. Next, prepare, your theoretical part a bit. And then in the morning, wake up early. Please eat something, because if it's a longer surgery, for example, you're going for a gastric bypass, or any long a flap surgery, in plastic surgery, if you're attending any flap surgeries, they tend to go on for a long time. They can go up to 7 hours as well. So if you don't eat anything in the morning, there's a chance you'll get hypoglycemic and collapse. And obviously you do not need any more calamity in the theater. You do not want the surgeon and the nurses to leave the case aside and come and attend to you. So do not be an added burden in the OT. So eat something, leave all your fat diets, your keto, everything aside, and eat something in the morning. Always reach at least half an hour. So if your case is at 8 in the morning, I say reach at least by 7:30. Go to the pre-op area. Most of the hospitals, even the government hospitals, have a pre-op area. Go there, interact with the patient, try and calm the patient down. You're a doctor. I think when you're in medical school, you're a doctor. So you need to learn soft skills. Go interact with the patient, calm the patient down. See how you're Go meet up with your resident, talk to them, learn more about the case, learn about that specific case. Now, every case is different, everybody is different. So learn, take the history of that patient. I mean, don't ask history right before her surgery. She's going to get No, he or she is going to get nervous. So ask your resident about the history, what the case is exactly about. Talk to the OT nurses. Whenever you enter, please introduce yourself, because no one cares who you are. So make sure everyone knows you're a student or you're an intern. Introduce yourself. Ask the surgeon if you can scrub in. Do not scrub in before asking the resident or a surgeon. Generally, the resident doesn't take the call. So ask the surgeon if you can scrub in. And 99% of the times you are allowed to scrub in, even if you're a student, and they'll actually help. They'll actually ask you to assist them. So you can be, I mean, since you are not a surgeon, you can hold retractors, but you will at least get, exposure to the, operating field, which is important because that's when you learn. If you do not get to scrub in, this is just some brownie points. Act a bit, so basically what I used to do is I used to adjust the lights for the surgeons. So I used to get impressed. Oh, because it's very difficult when you're operating to constantly adjust the lights. So if you're short staff, just volunteer in adjusting the lights. That way you're closer to the operating field. You can see what is going on and you're impressing the surgeon at the same time. So probably the next case you might get to scrub in. So these are a few things that might help you. Also, sometimes the preparation for the case just doesn't start the previous day. It can happen 2 days prior to that when you're taking consent, or sometimes you take the consent a night prior to the surgery. So attend the rounds with the on-call resident or the surgeon. Attend rounds with them before the case starts to see how they are counseling the patient about the case. They might explain the procedure as well to the patient so the patient knows what's happening. Mostly in government hospitals, they don't do that. So again, that's a learning thing, what you should be doing and what you should not be doing. I think you should definitely, stick to one or two surgeons, shadow them around and learn what they're doing. Compare. I'm not saying compare, and certain things you have to just say it in your mind and don't say it out loud. So if you feel like a surgeon doesn't have the soft skills, a bedside soft skill, in your mind, but do not correct the surgeon, because not everyone likes to be corrected, unfortunately. Not everyone is that open-minded. So discuss the case, see how they're taking consent. Now, I've seen many senior residents and interns while taking the consent. So when you take the consent form, you have to also tell the complications to the patient. So I've just seen them writing bleeding and death. And imagine you are writing that and you're telling the patient to sign, and the patient is literally looking at bleeding and death and like, okay, these are the only two complications, first of all. And bleeding, and then the next one is death. I mean, you're not explaining anything. The patient is already anxious. You're kind of getting up their anxiety levels. So avoid that. See, so again, the complications are important. So you will read up on the case. You will know, for example, now a complication of a lap chole is going to be different from a fibula-free flap. So you'll have flap failure or something, but in a lap chole, you won't have that. You'll have different complications. So keep all those things in mind. And so that's about the OT etiquette in general. Now we dive into a step-by-step fashion of how you dress in the OT. What do you exactly do there? What do you do while you come out? So let me start with the common term everyone has heard, scrubbing. So what exactly do you think is scrubbing? Please type in the chat box. I want it to be interactive, or we're just going to waste time. So what, according to you, is scrubbing? Anyone wants to unmute and talk, please feel free to. Anyone from the GSN? Anyone from the GSN team, please feel free to answer as well. What is scrubbing? Why is it different from hand washing? Anyone? Okay, I can't see people out here, but Reena, Divya, any one of you, Tejas, anyone that wants to answer? What is scrubbing exactly? Come on, guys.
Dr. Hansel, we have responses in the chat.
Okay, but you know what? I can't see it for some reason. How do I check that out? I'm very bad with Zoom, unfortunately. Should I exit this or what? Okay. Oh yeah.
Okay,
Okay, got it.
yeah, if you can.
So
Otherwise, we can just ask the participants. You all can unmute and answer all these
yeah, I
questions.
think that's better because if you can see my screen, I'm not getting any notifications for chat.
Yeah,
So I think
yeah.
unmuting
So,
makes more sense.
yeah. So, how about the participants, instead of typing on the chat box, you all can unmute yourselves and just answer.
Also, one thing, so what we'll do is, since the session is going on and there's some glitch where I can't see chats, so let's just keep unmuting and talking. That makes more sense. And towards the end of the session, if you have any doubts, I think leave it in the chat, so we can address it at the end of the session. And I can't see you guys anyway, so you don't have to feel shy, just unmute and talk. Or if any of the GSN members can read out their chat to me, that also is fine. Like any, if Reena or Divya, anyone can read out the chat to me also is fine.
Okay, I'll do that. Ritik says donning with aseptic precautions, and Japleen says decontaminating the hands.
Okay, someone said aseptic precautions. Okay, so you use an aseptic solution. Now tell me, what is the difference between an aseptic solution and a disinfectant? Since you said aseptic, so what is the difference between aseptic solution and disinfectant?
Hello.
Yeah, tell me. Just
Yes.
introduce yourself and go ahead.
Good evening. I'm Ritik Savla, third year MBBS from GGMC Mumbai. So asepsis basically means decontamination, but not destroying the natural flora of the skin. And disinfection, in the oral sense, it also destroys the normal flora. So we use asepsis instead of disinfection directly.
Yeah, but there's one point here. Disinfectants are generally used on surfaces. So you say now what you use, like your betadine scrubs that you use, those are aseptics. But disinfectants will be something like those Dettol sprays that you use. Okay, if that makes sense.
Yeah.
Okay, perfect. So scrubbing is nothing but hand washing, but there's a but. It is a systematic process. Okay, so you just don't just go and wash your hands and then you go and operate. No, it's not that. And why it is not that is because the area from your fingertips to your elbows is the closest to the operating field. So there's more chance of contamination. If you do not wash your hands properly, the patient may end up with complications like a surgical site infection. Okay, so scrubbing is basically a systematic process of hand washing. Now, we do not do it quickly. We spend at least 3 to 5 minutes. Now, WHO says 3 minutes, but what we follow is 5 minutes. Now, the first hand wash, so the first case of your day. So say you have 3 OT scheduled, you're packed for the day, you're going to be operating consecutively in different other theaters or whatever, different other cases. So your first hand wash is going to be for 5 minutes. And the consequent cases, the hand wash, or if you dewash and you go out and then you come and you scrub in again, then that's when you will wash your hands for 3 minutes. You don't need to completely go through the entire process. Now, there is something called as WHR. Do you know what is a WHR? Those are waterless hand rubs. Okay, so they are basically like your sanitizers, but they are obviously of a different strength. They have chlorhexidine and they have, they have better cleaning properties. So basically, there are some studies that say that waterless hand rubs are better because, first of all, they're more compliant. The surgeon is not going to waste his time constantly, washing his hands. So first of all, they're more compliant, and secondly, because of the contents, they are better than your hand washing with antiseptics. Now, can anyone tell me what do we use for? Do we use soap? Do we use Dettol hand wash? What Lifebuoy? What do we use to wash or scrub our hands during a proper surgical scrub? And tell me the contents also if you can. Anyone? I saw one chat message, but I can't open it.
Renu says betadine. Japleen says chlorhexidine.
Yes. So we use, it depends again now, who decides it? It's the infection control department of your hospital. Or like every hospital has their different standards and guidelines. So most of them use betadine. Now betadine is again a brand name. It's called povidone iodine. Now the strength can be anywhere from 7.5 to 10%. Now what you use, most of you interns, you use in the ERs is the betadine solution. Now this is scrub. So there's, additional surfactant or an addition of a detergent in it. So that makes it soapy. So the strength is 7.5 to 10%. You use chlorhexidine. Chlorhexidine is a better cleaner in my point of view, and many studies say that as well. So in the US, they used the surgeon I worked with, he used Cutacept. So that was chlorhexidine. That was pink in color. So again, it depends on the manufacturer. All right. So yeah, as I said, it's a systematic way of washing your hands. Now, when you scrub, you cannot be very aggressive. What happens if you're very aggressive? You will have micro tears in your skin, and that is going to harbor and grow more bacteria. So it's counterintuitive. So do not scrub. So just because I'm saying scrub doesn't mean you actually go on peeling your skin. You have to be gentle. But you have to cover each and every part of your hand. Now you have to, since your fingers and your hands are going to be in the operating field, in direct contact, you have to imagine that your hand, now I'm saying imagine your hands are sterile because you're not making them sterile. What is sterility? Can anyone tell me what sterility is? Anyone? Are you autoclaving your hands? You're not autoclaving your hands. So your hands are not sterile, okay? There is some, your normal flora that's going to be on your hand, and you are just going to clean it to get rid of any debris, dirt, any, other flora that's there on your hand, but you're not completely getting sterile, okay? So, but just I'm saying, imagine, since your fingers and your hands are going to be in direct contact with the operating field, so you have to consider your hands as sterile. So when you start washing, you start with your fingers, go to your hand, and then proceed to your elbow, and do not come backwards, okay? Because this is considered dirty, this is considered clean, and this has to be the cleanest. So you start from top, you go to bottom, you don't go from bottom to top, okay? We'll cover all this. There are some nice videos which you'll understand. Divide your hands, your fingers, your nails into surfaces. So for example, now many of the kids in the US and the UK, they have a sponge, and they have some a nail pick to clean your nails. So you do a pre-wash, which is basically you just wet your hands, and you can use your so there is a bottle or a pump. So if there's a pump, okay, now this is not in the video, but say there is a pump with a dispenser and it's not an auto dispenser, what do? You use your elbow to press. Suppose this is the pump. You use your elbow to press the pump, and then you wash your hand. You do not use your hands. Always get into the habit of using your elbow. All right. And you dispense it, wash your hands. This is a pre-wash. Just clean it. Okay. And then open and keep your the sponge and the nail pick packet open. The tear has to be facing upwards so you can remove the sponge easily. Now wet it a bit so it can get a bit foamy and soapy and clean well. And then first start cleaning your nails. So especially girls, those who have extensions, first of all, do not, if you're a surgeon, honestly, I'm not going to tell you what to do, what not to do, but extensions don't make sense because when you wear your gloves, it's just going to tear through them. So keep your nails short, keep them clean. And in fact, they look pretty, but they're the dirtiest because when you have extensions, you have all the colors and all the nail art on it, you actually can't see the dirt beneath your nails. So try avoiding it and clean your nails nicely first. And then you take the sponge, you take the rough surface, and you start again scrubbing your nails. Okay. If you have rough palms, you can use that for your palms. I don't suggest it because it's going to cause micro tears. Take the smooth part of the sponge and start dividing your hand into surfaces. First, you go with your finger. You take your finger with like each finger 20 to 30 strokes. Since we are taking about 5 minutes to wash our hands, so 20 to 30 strokes, the front surface, the back surface, the lateral surface, and the medial surface. So 20 strokes for each surface. So you do that to each finger. Then you go to your palm. Okay. Do front, back, lateral. This is 3 surfaces. Then you repeat the same process on your second hand, on the other hand. Okay. On the opposite hand. And then you go for the arms and the elbows, for the forearms and the elbows. So you do you keep on mirroring it, and then last towards the elbows. So that's about scrubbing. You'll see the videos, and I think let's go step by step. So first slide. So this is what we're going to be doing today: scrubbing, gowning, gloving, and degloving. Okay. Scrubbing is an important procedure required to reduce the risk of contamination by microorganisms during operative procedures. As I said, complication can be surgical site infections. Okay, so we are avoiding post-op infections. Yeah, so it's basically decontamination of your hands. Now, since this is dress to impress, so what is your attire going to be like? Your surgical scrubs. Okay, so what you wear inside your gown. So you wear a gown before you operate. You just don't go with your scrubs. So that's your surgical scrubs. Basically, do not keep them dangling over your elbow. Try to keep it at least 2 to 3 inches. If you're short and your scrubs are long, fold your sleeves before you wash, because what happens is the sleeve dangles over the elbow and then it all gets wet. It all gets messy. Again, you're at a risk of contamination. So make sure your sleeves are adequate, from having an adequate distance between the elbow and the sleeve of your scrubs. Okay, now I have one question. So I just mentioned about surgical gowns. Which colored surgical gowns do we have? Scrubs, there are many scrub colors. Again, scrub colors are basically, you've seen those Kanya Med and figs and all. They have blue, purple, different colors, doesn't matter. But what specific colors have you seen scrub gowns in? Can anyone tell me?
Green.
We have blue and green.
Blue, green.
Blue and yes. So surgical gowns, sorry, not scrubs. Surgical gowns are predominantly, in fact, only of blue and green color. And do you know why it is not in any other color? Have you ever asked this question? I think I did mention one question in your pre-event questionnaire. So why is it not a white color? I mean, white is supposed to be a sign for purity and cleanliness. Why is it not white? There are two main reasons. So if anyone can tell me even one, it's okay. Why is it not white, and why is it blue, and why is it green or green? Anyone? Okay, I don't expect you to know this, but it's just so since operating will cause a lot of blood to go here and there, so that's just going to protect you from the blood, right? And that's again sterile, the gown. So blue and green act as very good contrast to the blood, the red blood. But now you'll ask me, Hansel, why is not a white? I mean, white is the best contrast to red, right? Blood coming on white, matlab that's to ekdam zyada contrast ho gaya na, wo to that is to better. In fact, white was used earlier, very early in if you go back in history, the old surgeons, the surgeons in the last century, they did use white scrubs. But you know what was the problem? When you're in the operating zone, you have so many lights on you, okay? Those white lights, those yellow lights, and you're wearing a white gown. White is reflective. So you actually have to put more strain on your eyes when you're operating, because everything is just so reflective. Okay, so white is actually very disturbing to the eye. It causes a lot of vision issues. So that's why blue is first of all calming, green calm colors, cool colors, nice colors, and at the same time they're doing the job. So that's why blue and green are the standard colors. I hope that gets clear. Okay, it's just something nice to know. Anyway, so your scrub attire. So you have to wear scrubs beneath your surgical gown. Yeah. And then you have to remove all your accessories. So you can't have dangly earrings. You can't have rings. You'll be like, but Hansel, why can't we have rings beneath our gloves? Simple reason, the glove will tear. Okay. So remove your rings. Even if you're religious or you're married, honestly, when you enter the OT, you have to leave your religion out of the door. You have to leave your marriage out of the door and enter in. So that is your space, okay, where you are constantly focusing on work. So leave that. And always before you enter any surgical area. So what do I mean by surgical area? even the pre-op area, it's always a good practice, or the area in which all the OT rooms are. So obviously every OT is separate, but there's an entire room which has all the OTs in it. So when you enter that area, always wear surgical your scrub cap, and always wear your mask. Okay, that's always a good practice. In fact, many hospitals are strict; they won't let you enter in without that. Now, coming to the scrub cap later, there's a very nice point I want to cover with that as well. Okay, so your pre-scrub wash. What will you do? You'll first wet your hands and arms. As I said, the first wash is just a regular wash. Okay, so then use your scrub, so your surgical scrub with whatever you use in your hospital. It can be betadine, Cuticept, whatever. Wash it. Okay, you go like this. Lather your entire hand properly. Go to your elbow. Okay, and then when you wash it, obviously most of the OTs have an automatic the touch sensor, the sensor tap. Most of them have something that needs to be operated by foot. So whatever, depends on whatever you have in your hospital. And when you wash your hand, go like this. Okay, go like this underwater, and then keep your hands like this, 90-degree or higher at the level of the elbow. Do not keep it closer to your torso, your trunk, or your chest, because there is more chance of contamination that way. And when you keep it ahead, please make sure you tilt a bit forward, put your hips behind, so it gives you more area. Also, be careful that you do not touch the tap. Now you'll be like, okay, the tap is clean. No, it's not. You touch any other surface apart from the water and from the soap, you have to start the process all over again. You just have to do it. Okay, so even if you, so like when you're washing, suppose you touch your pinky or the lateral aspect of your palm towards to the tap, you have to repeat the process all over again. Okay, next. Okay, this is a nice flow chart. So you wet the hands, the forearms, then you apply the antimicrobial solution. Okay, then you start creating a lather. Rub the right palm on the left. So first palm rubbing nicely, then go to the dorsum of your hands nicely. Then you can do this. So we generally don't do this, but it's a good practice to do this. Then go to each finger, okay, interdigit spaces, then your nails, and again use the nail filer, whatever, the nail pick, sorry, not the filer, the nail pick to clean your nail beds. And most of the private hospitals do have the sponge. I don't know if you have it in India. We've not used this in India, so it's mostly used in the US and the UK, the scrub with the brush. So you can just use your solution, your scrubbing solution, and do it with your fingers itself. All right. It's always a good practice, since you're just starting out, to set a timer. There's always a timer. Also, most of the OTs have a nice hand washing chart that is stuck in front of the basins. So it's always good to follow that. But since y'all are starting out, I always suggest put the timer on. Most of the hospitals also have a plastic gown that it's an unsterile one. Okay, so just to wear over your scrubs and under your gown. So sometimes there's a lot of water that gets splashed, so scrubs can get dirty. So it's a good practice to wear that as well. Okay, so rub palm to palm, then fingers interlaced. Okay, then rotational rubbing backwards and forwards with clasped fingers. This is what I was talking about. Then perform rotational rubbing of the thumb clasped in the other hand and vice versa. So basically your thumb cleaning, and rub the fingertips of one hand on the palm of the other hand and vice versa. We'll have a video at the end, so it will get clearer. Continue with the rotating action down opposing arms, and then rinse and repeat steps 1 to 7. Keep hand raised above elbows. This is very important. Repeat the second wash till 2/3 of the forearms and third till wrist only. So you have to, as I said, you have to divide. Think of your fingers and your hand as as sterile. Basically, you have to keep this clean at all times, and this is considered dirty. All right. Then the scrub procedure should last for 5 minutes, with further scrubs during the day lasting for 3 minutes. So your consequent scrubs can be for 3 minutes. Rinse the hand under running water, allowing the water to run from. Now, when you wash your hand, so when you're rinsing your hand with water, you don't have to remove the soap like this. You just have to let the water run, and it has to trickle down your elbow. It shouldn't come like this. Because what happens is if you keep your hand like this and you put your elbow under the tap, the unsterile area over here, okay, which is not washed, it comes along with the water down to your sterile area. So that makes no sense. It's going to be counterintuitive. All right. So this is a nice diagrammatic representation. This is how you wash your hands. You can, anyways, I think this is being recorded, but you can take a picture of it if you like. And these are the pictures that are always present in the hand washing zones outside the theaters. Now drying. So drying generally, so what happens is the basin area or the hand wash area is outside the OT. Then there is this automatic door that senses you're going to walk inside the OT. You come inside the OT and you have to have, so generally the scrub nurse keeps it ready because she has a count of the surgical team. So she knows that there's the main surgeon, the assisting surgeon, the resident, and probably an intern or a medical student. So she keeps those many packets ready. It's opened and kept on the sterile tray. Now this is sterile, so do not just go and bombard and just start touching things here and there, okay? Ask the nurse to open the packet for you, all right? It's on the sterile tray. Then so along with your gown, you'll have two white towels, okay? They are these fiber or paper towels, whatever it is. Now you open the towel, all right, with your fingers, and first dry your fingers in your palms. Okay, from one side of the towel, since it's a rectangular towel. Let me just take a tissue and show you. It's a squarish tissue. All right. So say this is a small one, but just to get a gist of it, you wipe your palm and your fingers from one side of the towel. Then use the dry end of the towel, turn it and dry your elbows and your forearms. All right. So that way you're not again cross-contamination, not cross-contaminated. All right. So open the hand towel fully. Do not allow it to touch any unsterile object or sterile parts of your body. Hold your hands and hands and arms above your elbow always. This is so don't touch it to your gown, don't touch it to your scrubs, don't touch it anywhere else. Always keep it in the air. Don't keep on doing this. Some people dry their hands. I used to do it once upon a time. Don't do it because it's just going to have more deposition of microorganisms on your hand when you keep on rubbing it against the air. Okay. Dry the fingers of the opposite hand using blotting or rotate. So don't do this again because what happens is this friction is going to cause a lot of additional debris that will be formed on your skin from your dead cells. So we don't want that, okay? Because the whole point is cleaning it off and you're adding more. So just blot it, okay? And then move the dry area of the towel and continue in this manner down the forearm to the elbow and then repeat it, okay? Anyways, now let's watch the video so that'll help you a bit. I hope you can see it. Yeah. Oh, before I go ahead with it, can you all see the video play and can you hear it? Can anyone unmute and please let me know so I can continue playing? I don't want you guys to miss out.
Yes, we can see it.
Can you all see? Oh, lovely. Okay. Okay, so I hope that video made it clear. If you saw when she was rinsing the soap off her hands with water, she kept it at a diagonal, position. So basically, she didn't keep it like this or like this. It was like this, where the elbow was facing down, so that the water doesn't trickle back towards your palm and your fingers. Just before we go on to gowning, I want you to keep a few infection control things in mind. Now, for example, most of you are so, in fact, this was not the trend before I finished my internship. Like now, scrubs are so easily accessible online. So we all, like to have our own scrubs with our own names. But as students, I see a problem with that. Number one, always use the scrubs that are provided by hospitals. Unless you are a full-fledged surgeon, you can do whatever you want. But if you're a student, I suggest you always use the hospital scrubs. One reason is because they are cleaned and washed properly. Okay, they follow the infection control policies of the hospital, and that's how the scrubs are washed. So always use that, because not necessarily you wash your scrubs well. I mean, who knows? Secondly, your caps, your scrub caps. Everyone loves to have their own scrub caps as well, but always operate using the hospital scrub caps if you can. I mean, even if you attend or assist. So again, in the hospital scrub caps, you have the corrugated ones, the ones which I don't know how to explain it, but the ones which come as a strip and then you open it up like a hairnet and you put it. So that's one. And the other one is already like the male. So I don't know, some hospitals call it a male and female scrub cap, which makes sense. I'll tell you why. I've seen many females wearing the male scrub cap. Again, I'm not trying to be sexist, but males don't have long hair. They don't tie their hair in buns. That is not going to completely fit your head properly. It might cover a male's hair, but it's not going to cover a female's hair if the female has long hair. So always use the corrugated one and completely cover your hair, because we tend to lose hair, which is natural. We can have breakage, and that might fall in the operating field, and we do not want that. Again, it looks very shabby when your hair is just jetting out of everywhere. So and I see this issue with most of the students. They do not want to wear that the netty kind of the scrub cap, is because it looks weird. It doesn't look like a surgeon's cap. All surgeons wear that. Please don't think about all these things, because at the end, what is important is your patient over there. It's not how you look. Okay, if you perform good work and you ensure that you're maintaining sterility, you're not contaminating the area, you're neatly dressed, it doesn't matter whether you're what cap you're wearing. Okay, so don't go by that. Wear a proper cap and make sure your hair is completely covered. All right, because sometimes those other caps tend to retract and slip back. All right, that's number one. Anyone who has spectacles, anyone who wears specs. So when you're under the operating, when you're under this operating table lights, it gets a bit hot. Okay, sometimes you start sweating also. So the spectacles can slip off. And there was there was this unfortunate. So I really have a lot of interesting stories to tell you. One of them is one of the resident surgeons had his spectacles fall in the abdomen in a laparotomy case. So it actually fell in it. So yeah, try avoid that. So again, it might look funny, but you get these micropore dynaplast tapes. Just secure your spectacles well. Sometimes they can also get fogged up because you're wearing a mask as well at that time. So use some anti-fogging spray on your glasses if that works. So you need to have all this prepared before you are operating, because you don't have time to waste. You're increasing the induction time, you're increasing the time the patient is under anesthesia, which is not good. So do not let your patient suffer just because you have not come prepared. And again, these are infection control things, so keep that in mind. The next thing is, yeah, about your footwear. So most of the hospitals have a demarcated area where before you enter that area, you have to leave your footwear behind, and then you use the hospital footwear. Again, I suggest using the hospital footwear because they're cleaned properly as per the infection control protocol of that particular hospital. Because if you're getting your shoes from somewhere from your house, not necessarily it has been cleaned. Okay, so you can buy yourself a comfortable pair of your size, a new one, and keep it in the hospital. But again, there's a chance of theft. So you have to figure that out for yourself. And do not wear hospital slippers outside, the OT slippers outside the OT and roam in the entire hospital. Because again, you're getting infections and hospital acquired infections and bacteria and viruses from other parts of the hospital to the OT. So don't do that. All right. One more important thing, since you're going to be in a surgical team, do you know what comprises of a surgical team? And since we finished scrubbing, who all, like, which persons in the surgical team scrubbing? Can anyone tell me if you've attended surgeries? Who are the members of a surgical team? Anybody, please, you can unmute yourself and just talk. That's fine. Again, I'm sorry, I can't read chats because the chat box is just not opening. I'm getting the, yeah.
Renu says consultant SR.
Mm-hmm. Okay,
Maybe
so you think,
year 3.
Okay. Okay, so a surgical team is not just the surgeons or the surgical trainees. It is everyone who's present in that specific OT. Say you have 5 OTs, the surgical team of OT1 is going to be operating on that case, but everyone, including, so when you have something as a sign in and a sign out. Mostly it's followed in private hospitals in India. Here in the UK, in the US, it's followed everywhere. Government hospitals sometimes may or may not follow it. You have to introduce yourself. You have to introduce the case. Who's the so I'll just tell you in short before we get into the sign-in part. So your surgical team will have your operating surgeon, your assistant surgeon, so they can be 2 surgeons operating. It can have your SR or your registrar or your senior resident, your SR, your JR, or all your residents. Okay, it can have a medical student, an intern. It does have the OT scrub nurse. Okay, so they can be 1 or 2 scrub nurses, and they can alternate. Like if it's a long case, the one of the scrub nurses stays for 3 hours, then she goes on a break and she becomes a circulating nurse. So circulating nurse doesn't scrub in. Okay, the OT scrub nurse scrubs in, and she's handing over the instruments and adjusting the light just in case, or whatever. You have your anesthetists. How can you forget your anesthetists, darlings? Your anesthetists are also part of your surgical team. Then you have your helpers or your ward boys. They are also a part, because when you many surgeons use cautery. So if you're using a monopolar, bipolar, they will connect the cautery to the source. They will put the pads on the patient. They will position the patient. They will shift the patient from the hospital bed to the operating table. Yeah. If you need gloves, so the circulating nurse if the circulating nurse is gone for a break, circulating nurse, as I said, she doesn't scrub in, he or she. The ward boy will give you your size of glove. He'll open it and then he'll drop it on the sterile tray. Yeah. So these all are a part of your surgical team. So do not leave them out. They are also part of your surgical team. And when you sign in, you have to sign in that fashion, that this one is operating, this one is the assistant, this one is the registrar, this is the case. Then this is the circulating nurse, this is that one, this is the anesthetist when the patient is going to get induced. Just give me 1 sec. I need to connect my laptop to a passer. Yeah. Apart from that, yeah, so the sign-in procedure is done that way. Now, do you think anesthetists scrub in? So we know that the OT scrub nurse scrubs in, the attending is scrubbing in, the registrars and the residents. Do anesthetists scrub in? Can anyone tell me yes or no?
Yes, they do.
Okay. And when do they scrub in? Do they always scrub in, or do they occasionally scrub in?
Occasionally, whenever they
And then is
do a procedure
yeah, what procedure?
like tracheostomy or something, like emergency.
Correct. So anesthetists don't always scrub in. So yeah, though they are MD anesthesia, they are the only medical related profession that can scrub in, apart from gastroenterologists. Even they scrub in at times when they do invasive procedures like colonoscopies and all. Some surgeons do scrub in for that. But yeah, anesthetists do scrub in. For example, when you're giving a spinal block, okay, or an epidural, you give a spinal block, so you have to scrub in because you're dealing with the spine, obviously. That's done pre-op. I mean, the patient is already taken on the OT table, and that's when they're inducing the patient. So that's a time where the anesthetist also scrubs in. So yeah, don't forget that. And do we what kind of procedures do we scrub in for? Do we scrub in for let me give you an example. Say there's a cosmetic surgeon who's doing Botox or fillers. Do you scrub in for procedures like that? You'll say, but those are also invasive procedures, so you should scrub in for that. But no, you don't scrub in for minor procedures like where you're only using, a syringe or a needle. So that you just have to clean the area with betadine or Cutacept or whatever the protocol is. And so for minimally invasive procedures, generally, local procedures, you do not scrub in. But yes, for other procedures, invasive procedures, as I said, gastroenterologists do scrub in for colonoscopies at times. So yeah, scrubbing in, again, you should know when you scrub in, when you don't scrub in. So this is the trend I've noticed when I was in the government hospital in Mumbai. We did not scrub in for minor OTs. So be it a toenail removal, or be it a sebaceous cyst or a midline swelling. I mean, midline swellings were done in a minor OT, imagine. So, and I hope you guys do practice, the CT protocol for a midline swelling. So even if you see a sebaceous cyst or any sort of cyst in the midline, you have to send the patient for a CT because it can be communicating. So always keep that in mind, that in some hospitals, minor OTs, you do not require scrubbings. In private hospitals, mostly who follow the UK US guidelines, they do require a scrubbing even for minor procedures like toenail removal. Yeah, so I have scrubbed in for such procedures as well. So keep that in mind. Now we go to gowning. So we already discussed about the color of the gown. Yeah. Also, I wanted to, as I told you, I had some funny stories. So regards to scrubs, make sure if you're wearing the hospital scrubs, they are of the right size, because the pants are sometimes loose or tight and they are secured with a string. There was this case where I was assisting a surgeon, and it was a very big case. Luckily, the guy was protected because he had scrubbed in and he had his surgical gown, but his pant fell off mid procedure. And we did not see anything. That's because he was covered by his gown. But imagine the embarrassment and imagine the discomfort. So he had to, imagine, like, I honestly even couldn't figure out how he got out of the gown and how he degloved and stuff like that. So you want to avoid such situations. So make sure you've tied your pant tight, and you worn a right shirt with the sleeves that do not dangle over your elbows. And just, if you've seen in the video, the nurse had a good distance between the sleeve and the elbow. So make sure you do that. Now, gowning. Surgical gowning and gloving is an essential element of peri-operative practice and is undertaken by the members of the anesthetic and surgical teams involved in peri-operative intervention or procedures. So yes, the anesthetists might not scrub in, but they do wear a gown because it's a sterile environment. When they move around, you can accidentally touch the table in which the sterile instruments are, or you can touch the surgeon. Sometimes the operating rooms are small. So it is required for an anesthetist to also wear a gown, okay, which is sterile. Gowning and gloving will take place immediately after surgical antisepsis, and the whole process is often referred to as scrubbing, gowning, and gloving. So as I told you, you have a kit, right? So in your gown kit, you'll have your gown, surgical gown, and you'll have the towels. All right. Now you tell the rotating nurse or the scrub nurse before the surgery starts that this is your glove size. Now, when it comes to gloving, that's the third part, but it is always a good practice to first of all tell the right size to the nurse that, this is my glove size, so please keep it ready. Keep extra gloves ready because you can have tears. As always a good practice to double glove. Okay. Now, sometimes if you are dealing with a seropositive case, so it can be a Hep B or it can be an HIV or whatever, you also get additionally a mask and or goggles, and you get a headgear. So it looks like a hazmat suit. So it's like your surgical cap. You wear a surgical cap, and then you wear this. It's made of the same material your gown is made of, and then you tie a knot here. So this is what I'm used to, and you tie a knot here, so it covers your entire thing. It can also cover a male's beard, yeah. And you wear the shield or you wear your goggles so that the blood doesn't splash on you. And seropositive blood splashing is not a good thing. And double gloving should not only be done in seropositive cases, it should be a general practice. So your first glove needs to be your exact hand size. So my exact size is a 6.5, and then I wear a 7 on top of it. Don't wear a very loose glove, because you are not going to, especially if you're operating or assisting, dexterity becomes a problem. You're not being able to move your fingers properly. So make sure you wear a right glove size first and then a slightly bigger one on top of it. All right, we'll come to that later. So yes, the gowning kit. I'm sorry, what's happening? Okay, now picking up the gown. So pick up the entire folded gown from the wrapper with one hand by grasp. So now your hands are clean. Your hands are clean but not sterile. So you do not touch the outer surface. So when the gowns are made or packed, the inner surface which comes on your scrubs or on your body faces towards you. So what you do is, since you pick it up, you don't pick it up from the outer surface, because the outer surface has to be sterile. That is going to be in contact with the operating field. So what you do is you pick it up with your finger. So this is the packet. You put your hand inside that, and then you spread it out, and the thing just opens up on you. There is a video, I think, on that as well. But if I'm ever scrubbing in here, I can make a video and I can show you, because that's a bit of a tricky part and not many get it. And you end up, not following the OT etiquette. So that's not good, right? So I'll try to record if I can whenever I scrub in here. Yeah. So so be careful to touch only the inside top layer which is exposed and not the outer side. So don't open it like this and dust it like a like a cloth, but put your fingers inside and then spread it out. All right. Once your hands are securely pinching the gown, step back and allow the gown to drop. As I said, make sure the gown does not touch any surrounding unsterile objects. So make sure there is nothing around you because when you do this motion also, someone can just be walking past and you might just touch their face. So you're unsterile. All right. Now, one more thing about the gown. So the front part, the one that faces the operating field, so you're from like your chest and your torso up to your hips is considered to be sterile. Some areas just take the chest area and like the epigastric area, that's it. So that's supposed to be sterile. So anything that's down is supposed to be considered unsterile. Your back is supposed to be considered unsterile. So whenever you are in that position, your hands are dried, obviously, but you won't keep your hands down. Your hands can be kept folded like this, or for once in your life, you can pray or make the gesture of praying. So you can just stand like this. Okay. Now, when you put your gown, there is this cloth kind of tight elastic here. So do not put your hands out through that. Let it cover your arms, because this is sterile. Your hands are not sterile. Though you washed it and you scrubbed it, it's not sterile. So do not put it out. Let that elastic white part cover your fingers. All right. We'll see a video about that later. Now, insert your arms into the gown. Grasp the inside shoulder seams and open the gown with the armholes facing. Carefully insert your arms part away into the gown, one at a time, keeping hands at the shoulder level away from the body. Slide the arms further into the gown sleeves and grasp the inside seam at the cuff, the cloth cuff I was talking about, using the thumb and the index finger for me. So you have to be very mechanical. I mean, certain things I can't explain. As I said, there is a lot of downside with virtual learning. So I'll try to make a video, but there are a lot of videos available online as well if you would like to. Now, fastening the gown. This is very important. So most of the blue gowns that we have, which are pre-packaged, I'm not talking about the cloth gowns that are autoclaved and stuff like that in government hospitals. I'm talking about the ones with the paper attached to it. Okay, so generally you rotate. So you remove the paper with the string attached to it. You give it to anyone. It can be unsterile as well. That's all right. And then you twirl, and then he removes it, and you have to take the sterile part of the string, not the paper. Now, because someone else just touched the paper, it is unsterile. So you take the string and then you fasten it. All right. A theater assistant will fasten the gown behind you, positioning it over the shoulders by grasping the inside surface of the gown at the shoulder seam. The theater assistant's hand should only ever be in contact with the inside surface of the gown. Okay, so what happens is this area needs to be secured, the one behind your neck. The string near your waist has to be tight. So this can be done by an unsterile person, because as I said, the back is also considered unsterile. So this person can definitely tie the strings behind your neck. Okay. Yeah, gloving. So this is about wearing your gown. Now, after you wear your gown, make sure you do not touch your gown here and there. Keep your hands in one position. You've done now you have to wear your gloves, right? So don't keep your hands down. Keep it on your chest, on the sterile area. All right. Now, gloving. Open the inner glove packet and pick one glove by the folded cuff edge. Now the folded cuff edge is, if you see a sterile glove, I don't know how many of you have seen it. When you open the packet and you see the glove, the part that fits over your wrist is folded. So that part which is outside actually goes inside. Okay, so that can be unsterile because it's touching your hand anyways, the inside surface. But the outside surface of the glove, which actually goes into the operating field, has to be sterile. So make sure your hands, fingers, when they are bare, they do not touch the outside surface. Deal with the inside surface. Now, since that cotton cuff is covering your fingers are not exposed, through the cuff, you'll have to, your hand will kind of, so let me show it with the tissue. So suppose this is the cuff, okay, that the gown has. So you'll have to actually try to pick it up through the cuff, and then you take the glove. Suppose this is the glove. You keep it on the fingers of the glove have to be facing towards you. So you take it with your opposite hand. All right. So you take the right glove with your left hand. Keep it on your right palm, but keep it ulta. That is opposite way, facing towards you. The fingers will be facing towards you. Now that folded part of the cuff is this side. So now you slowly get your hands out through the cloth cuff of the gown and put it inside like this. So it's very complicated. You need to practice it in the OT. Okay. But the surgeon will at least know that you know your concepts. So we'll see a video. Now I don't have a glove to show you, but we can see a video and then you'll understand. So I don't think this will make any sense. Okay, degloving. Now grasp the cuff of the left glove with the glove fingers on the right hand and pull it inside out. Okay, so you first glove, you can just pull it like that. Now slip the ungloved fingers of the left hand under the cuff of the other hand, and again promote inside out. Okay, so you discard your glove. You don't pull it from the finger like this. The first glove, you can just pull it and then remove it, and then next put your finger inside and then remove it, and then wash your hands or use the waterless scrubs. Now, I don't know if this picture makes it any clearer, but you can just go through it once. You can just have a look and then we'll go to the video. If you want, you can take a screenshot as well. Okay, let's see this. This is a nice video. Yeah. Let me put my video on. Oh, one sec. Yeah, I'm sure if you guys practice this a few more times, you all will be superstars in your ORs. That's a nice tagline. But just keep this thing in mind that he said, so your cuffs need to cover the dorsum of your hand, because if it's lower than that, sometimes your gowns can get a bit uncomfortable. After long hours of surgery, you tend to stretch a bit and do this. And what happens is when you do this, the cuff comes even lower and it can actually come out of your glove. And I've seen senior surgeons actually have their arm exposed while operating. So I think the best person to teach you about sterility in the OR is your scrub nurse. They actually follow it to the T. Surgeons can tend to ignore certain bits and pieces of it, but you should not, because I've seen a lot of surgical site infections and it's very nasty. You end up debriding so much, and then you end up with wax dressings which go on for such a long time. You don't want it to get ugly. You want a nice clean minimal scar kind of a wound, post op. So try and avoid that. Learn from your scrub nurses. They are the best ones to teach you. In my opinion, I learned scrubbing from three of the best scrub nurses I've ever met. They were so kind and generous to teach me. So always ask. You have to learn to be a part of the team. That's a take home message. You learn how to be a part, an integral part of the team. Don't just be there for your selfish needs. Try and contribute in some way or the other. Like as I said, just move the lights around and do a bit of it. One more point, I don't know if you've heard of this term called as magic gowns. So many surgeons, since so when I was operating in plastic surgery, my consultants, we used to actually do 3 to 4 fibula flaps a day. I don't know if you know what fibula flaps are, but when you have cancer of the mandible, if you have an SCC of the mandible, you do a segmental mandibulectomy. So you remove part of your jaw, and then you take the fibula from the foot, from the leg, along. It's a free flap. So you take the blood vessels out with some muscle, with some fascia, with the bone, and then you reconstruct a jaw, because you're removing something. There's a defect, to fill that defect using a fibula flap. And those surgeries go on for, depending on surgeon skills and all, again, it's a lot to deal with. So 4 to 5 fibula flaps a day. So every so the OT used to start at 8 in the morning, get over at 9, 10 in the night. And so there were just two main plastic surgeons who had to, go to different. The onco surgeons used to remove the defect, or the max fac surgeon used to remove the defect, and then the plastic surgeon fills the defect with the fibula flap. So there were two main plastic surgeons, two registrars, me, and so we had to rotate between different OTs and just see where the OT has progressed to, because we had a shortage of staff again. So they used to wear these kind of magic gowns, and it used to basically cover their what do you say, their surgical gown. And then they used to go to the OT, look at what's happening, and then come out, remove that. Or you can just go. But when you switch OTs to see what's happening in the other OT, make sure the OT is not having an infected case. For example, if you're going from a plastic surgery OT to a colorectal OT, there's poop, there's shit, there's infected stuff over there, which you're going to carry to your plastic surgery OT, which you cannot, because again, the flap failure, infections and all, so you want to avoid all of that. So keep all those things in mind. Yeah, but apart from that, we've covered almost everything. I can leave my email in the chat box if you guys would like to have any discussion. So we have a WhatsApp group which has around 85 or 87 medical students, interns and final year students from Mumbai, all over Mumbai. If you guys want to be a part of it, we discuss a lot of surgical cases on that. So if the interns come across any novel case, they put it on the group with photos, or if they have any doubts to, how to deal with any case that has come in the ER, then they put their questions there. As I said, we are all willing to learn, and we all so don't be very rigid if you want to be a surgeon, because if you want to be a surgeon, you can't have a fixed way of thinking. You have to be very creative, you have to be innovative, and you have to always be willing to learn, because surgery is one never ending learning field, because there are so many developments, so many new things that are happening every day. So keep up to date with your knowledge, but also your skills. So be a good listener, your surgeon, your patients. One more thing about soft skills. There was this anesthetist who met this patient pre-op, and the patient was being wheeled in the OT. She was taken on the operating table. She was going to be induced, and she had come for a rhinoplasty. She had a deviated nasal septum, so she had a lot of breathing difficulties, and she had a bit of a visible deformity. The anesthetist, and she was a senior anesthetist. She, before inducing the patient, she goes to the patient, "Oh, but you don't need surgery. Your nose is okay. You don't need surgery. I wouldn't do surgery if I was in your place." Now that broke the patient's morale completely, and the patient started crying uncontrollably on table, and we had to cancel the OT for that day. So don't do such things. You have to be very supportive, you have to be very kind, you have to understand what the patient is going through at the same time, because you're the only hope the patient has. And then if you say something like that, you destroy the patient's morale at that time, because it takes a lot of courage to go on table. If any of you have had surgeries, you might understand what anxiety it is. So I always emphasize on being good listeners, and that's why I say, when you attend, do just don't attend the OT, attend pre-op, attend post-op counseling, attend consent taking, attend all these things, so you know how the entire process is. It's just not about surgery. Okay, so I'll just stop sharing the screen so I can type in the chat box. I hope you guys found it informative. I know you guys are not going to become pro at scrubbing or gowning with this. It is just going to give you some background so you can save yourself from some embarrassment when you go for your first OT. And the surgeon will also be impressed as to your knowledge of scrubbing, and they will definitely be willing to guide you as well.
Ma'am, you are muted right now.
I'm sorry. I can't give you the link of the group because I'm on my laptop and I don't have it right now. But you can send me an email, or I can also give you my WhatsApp number. I'll give you my Indian number once. And you can just send me. Did you see it? Oh, okay. This is my WhatsApp number. Yeah. If you have any questions, please ask me. Is there a time? Oh, I can see all your chats now. That's very nice. You guys know a lot. That's nice. I'm sorry I couldn't see it while sharing the screen. Any questions? Anything, not necessarily related to this topic. You can ask me anything. If you want to know anything, just shoot. I don't think we have any questions. Asma Fatima. Yes, Asma, if you can, as I said, I can't put the link here, but you can email or WhatsApp me and I can send it to you. Yeah, we can share the link of these YouTube videos. I think the GSN team can do that. They've done a very good job with the PPT. Very nice and lucid way of creating such nice content. So I think the GSN team, Divya, Reina, they can send it to you for sure. And I really appreciate, it was such a well organized and well organized session by the GSN team. So thank you so much. I think Akatya is not a part of this. I think, yeah, she's not here. But thanks to Akatya and Reena and Divya, they've been in constant touch. Thank you so much.
Thank you so much,
I would
Dr. Han.
I would definitely love the feedback. So if there's anything from my end that I'm open to feedback, so I can, help students in a better way. So please do let me know.
Surely.
Thank you. Thank you. So looking forward to staying in touch with all of you. Please do contact me if you need anything. And cheers.
Sure.
So with this, the session is coming to an end. Firstly, from the team GSN, an enormous thank you to Dr. Hansel Misquitta for taking a valuable time out from your very busy schedule to educate all of us, all of the participants in this meeting. Thank you so much to our president and to our vice president of the Global Working Group, Dr. Reena. To the Global Working Group team and all the other teams who have assisted us during this entire process of conducting this event. And thank you to all the participants who have joined us today with this amazing spirit and for your continuous support to the GSN events. And we really hope that you look forward to more of them in the future. We will be sending the link to the feedback form in the Zoom call and also on the WhatsApp group. Please make sure to fill that in order to avail your certificates. And very, very thank you to everyone who is present in the meeting today. We hope to see you again in future events conducted by GSN. Thank you so much.
I would like to request all the participants and the team members to switch on their web cameras so that